had a total of 507 active cases. 45,258 persons had recovered, and 297 persons had unfortunately died. As of Friday, 16th October, the number of active cases has declined further to 398, with 46,664 persons fully recovered from the virus, putting our recovery rate at 98.5%. 13 more deaths have occurred, bringing the total number of deaths tragically to 310, out of a total number of 510,074 persons tested. The rate of death, 0.5%, continues to remain very low. When you take a close look at the measures some other countries are having to take, including imposing nighttime curfews and partial lockdowns, declaring state of emergencies, limiting the numbers of people permitted at public gatherings, and mandatorily fining persons for not wearing masks, all in the bid to contain the second wave of the virus, we in Ghana have been spared all these developments and restrictions. We must, thus, be doing something right. In fact, our favorable situation at the moment is thanks to the effectiveness of government policies, the cooperation of you, the Ghanaian people, and ultimately to the grace of God. The science and data tells us that the trajectory of the virus in Ghana mirrors that of an epidemic with reduced disease activity. Our daily infection rates are no longer in the hundreds as they were some time back. Presently, they are in the tens, averaging 25 new cases per day in the course of last week. This is in sharp contrast with what is happening in the countries that are experiencing a second wave of infections, where in some instances, new infections and hospitalizations are sadly in the thousands per day. In spite of our successes, I'd like to reiterate that this virus remains something of a mystery, and we should always rather err on the side of caution and continue to observe the protocols that have brought us to where we are. As President of the Republic, I assured you of my continuing commitment to limiting and stopping the importation of the virus, containing its spread, providing adequate care for the sick, slowing down community spread, reducing the impact of the virus on social and economic life, and using the opportunity afforded by this pandemic to expand our domestic production capacity and deepen our self-reliance. I remain committed to these objectives, and I will not stray from them. Fellow Ghanaians, we all know that the emergence of the virus on our shores came from abroad, necessitating the closure of our borders by land, air, and sea in March 2020. Following the provision of testing facilities, which ensure the speed and accuracy of COVID-19 testing, Kotoka International Airport was reopened on 1st September 2020. It has been 6 weeks since the reopening, and a total of 30,564 passengers have been tested, from which 92 have tested positive. All 92 are asymptomatic cases whose status, but for the test, would not have been detected and would have spread the disease amongst the rest of the population. I'm aware that some are calling for government to extend the PCR negative test period before boarding the flight from 3 days to at least 5 days. I believe, in the context of the second wave of infections that is engulfing so many countries of Europe and America, that we have to insist on the 3-day period. It is better to be safe than sorry. Indeed, across the country, government has seen to the expansion of COVID-19 testing facilities from the initial 2 to 16, which include those of private sector providers. Additionally, some hospitals across the country have been equipped with the capacity to test for COVID-19. We now have more dedicated treatment facilities for dealing with the disease and have also improved considerably the availability of PPEs for our health workers. It is reassuring that we no longer have news of shortages or lack of PPEs. Through a public-private partnership, our nation is the beneficiary of a 100-bed infectious diseases center located at the Ga East Municipal Hospital, with plans in the offing to replicate it in Kumasi, Takoradi, and Tamale. Inasmuch as we currently have no patients at the isolation centers, I express the gratitude of the nation once again to private and religious bodies who provided their facilities to support the fight. These laudable efforts have manifested the collective will of the majority of Ghanaians to rally together, irrespective of ethnic, religious, or partisan political considerations, to help win this fight. It is important for me to stress that the cost of providing for the care of most persons stricken with the virus is being borne by government, ensuring that persons who tested positive and were in need of health care received it promptly. The strategic, controlled, progressive, safe easing of restrictions continues, with its overarching objective being to restore our lives and economy back to normal. SHS2 and JHS2 students are back in school, as are some students in tertiary institutions and colleges. Indeed, the academic year for new and continuing university students will commence from January 2021. Football, the passion of the nation, will return in 2 weeks. Private burials, still with a maximum of 100 persons, are being performed, and the limit on the numbers of persons who can attend conferences, workshops, and award events has been lifted, subject to the strict adherence of COVID-19 protocols. On the economic front, according to the Bank of Ghana, the Ghanaian economy is recovering faster than initially anticipated. Consumer confidence is bouncing back strongly and is today above pre-lockdown levels. Business confidence has also increased, reflecting the improving macroeconomic conditions, stability of the exchange rate, lower input prices, moderation in lending rates, and positive industry prospects. Consumer spending, industrial consumption of electricity, and construction activities have all reached pre-lockdown levels, whilst tourist arrivals and port harbor activity are gradually edging upwards. So I urge all of you, my fellow Ghanaians, to continue to comply with the strict hygiene, mask wearing, and social distancing protocols that have become part of our daily routines. This is the surest way by which we can defeat the virus and avoid a second wave of infections. The outlook on our battle against COVID-19 remains optimistic, for which we thank God and you, the Ghanaian people. It is important that we maintain this positive position, especially with a few weeks to the holding of the December 7 presidential and parliamentary elections. Enuanom, nhyehyɛe ayaye efa yare no onyankopon adaroma eye adwuma nanso yare no da so wo ho iti mesra mu titru mu frifia mu nkoso enhye mas no na mu ndi mu huni na no na beboa yen aboye ho bai na mayen kwan apam yare no kra ifriye mem anyame me gbejia no ni wotoke ha hilane ni modromona echuni chihela eyako ni wo titru ke wo hihia wo mask ni wo hie wo he fale no ni wo ke basa hilane ko ni wo ha hilane aje wonten kura. I've said before, let us continue to look out for one another and remain each other's keeper. And I'm confident that by so doing, we will emerge victorious in the fight against COVID-19. 0 active cases must be the goal. And I have no doubt that together and with the help of God, this too shall pass, for the battle is still the Lord's. May God bless us all in our homeland, Ghana, and make her great and strong. I thank you for your attention, and good night.
The first 2 cases of COVID-19 that happened in Ghana, or was confirmed in Ghana, on the March 12, 2020. As of 18th October 2020, Ghana's COVID-19 report stands at 47,538 total cases, with 46,789 recovered and 312 deaths, compared to the record of other neighboring and international countries. Were we lucky? No, we were not. Our government was proactive. If we had any luck, then it was the consequence of the proactive and calculated approach of the Akufo-Addo administration. At a time when leadership across nations were at dismay, this government took the bold decision to open up the economy and restore this country to a normalcy. This evening, we will bring you the facts on the stellar performance of the Akufo-Addo administration's handling of the COVID-19 pandemic in this country. I am Vincent Asifua, and I'm the parliamentary candidate for the Otafu constituency, and I'm your host for this show, Majority Caucus on Joynews. We are also live on all MPP social media platforms. Stay tuned, we'll be right back. You are most welcome. My name is Vincent Asifua Jr., and I'm the parliamentary candidate for the good people of Otafu constituency. Today in the studios we have the Deputy Information Minister, Mr. Pius Enam Hazide. I think this is the second time he's appearing on the show ever since we started the Majority Caucus. Today is going to throw more insight on COVID-19, the pandemic, how government has been able to manage this particular pandemic. Mr. Pius, good evening.
Good evening, Honorable Member of Parliament incoming. How are you and the good people of Tafo Prankrono? Well,
I'm just coming from the constituency. The good people of Tafo doing very well, and we are also gearing towards the 2027 December elections. So everything is fine in Otafo. But today, let me ask you this question. His Excellency the President, somewhere June or May thereabout, mentioned that we as a country know how to revive the economy. What we do not know is how to revive dead bodies, if I have to paraphrase him. What it means is that there was a deliberate attempt by the government to deal with COVID-19 now so that we can postpone the economy as to the difficulties that comes with the challenges as far as the economy is concerned could be dealt with later. At this point in time, do you think that as a nation we have been able to deal with COVID-19?
Yeah, thank you very much. Good evening to you again, and good evening to our cherished viewers as well. I also just returned from the Volta region. As you are well aware, you know that the president was in the Volta region on a one-day official visit, during which visit he commissioned the Naval Training Command within the district of the South Tong, and then he visited with the chiefs and people of Apipe, which happens to be my hometown proper, and also held a Deba of chiefs also at Joje. I want to, on behalf of His Excellency the President and his entourage, to use this platform of yours to show our heartfelt appreciation to the good people of the Volta region for the warm reception that was accorded His Excellency the President. The kind words of encouragement and the show of support and solidarity are very commendable. And on behalf of His Excellency, we want to again show appreciation to the people of the Volta. We remain committed to our covenant with the people, that just like we are doing in every part of the country, the Volta will continue to receive its fair share of the national cake. Right. Indeed, you are right. The President made that profound statement, which statement has become reference across the entire world of his government having the capacity to revive and resuscitate even a dead economy. But what we did not have the competence to do was to revive dead bodies, human beings who had died. And the evidence is abundant to support that claim. Any observer would notice that we inherited an economy that was growing around a paltry 3.4%, even though because of the good deeds of the earlier MPP administration, by 2011, growth had inched up to well in the double digits, over 14%. And this was handed over to the incompetent Mr. John Mahama, former president. And deliberately and gradually, a toxic mixture of competence and corruption, of incompetence and corruption, a toxic mixture of incompetence and corruption saw a nosedive of an economy that was on the trajectory on the back of oil that Kufuor had discovered, which had grown to in excesses of 14%. They had declined it from the 14% and over to a paltry 3.4%. When His Excellency Nana Akufo-Addo and Dr. Bawumia and their team took over, the trajectory reversed, and from 3.4%, we were growing in the margins on the average of above 7% until COVID struck. So the evidence is there for all to see. You can even benchmark against the earlier MPP administration, the Kufuor administration, in which the current president served as a minister with distinction. You can also check the track record. So if His Excellency the President makes the point that we in the MPP, we have demonstrated our capacity to revive an ailing and in fact dead economy, there is the evidence and there's a history to back that. But he is human enough, humble enough to admit that as for human life, it is so precious that everything has to be done to be able to protect human life. Because once that one is lost, at least nobody, just not the MPP administration, nobody in human history at this point has the capacity to wake up dead people. Nobody has done that, and we are not advised that anybody is about to do that in the shortest possible time. And so this is trite knowledge, and His Excellency the President is humble enough to admit that. But the implication of that comment that the President made is that he was going to ensure that no matter what it took, he was going to protect the lives of the people of Ghana. And that if in so doing, he had to make some sacrifices as far as the economic growth trajectory was concerned, he was prepared to do that in the meantime, because we know too well that these two, like he always says, shall pass, and that after this has passed, we have the competencies and we have the capacity to go back and revive the economy, because we have shown that we can do that with a dying or a dead economy. And I think that statement was visionary, and it has underpinned the operations of this government relative to COVID-19. And that's why people have rightly said that when you juxtapose the management of crisis, and we have had two major crises in contemporary history, the COVID-19, which is a natural disaster, if you may, and Doomsor, which was man-made financial management crisis. If you manage, or if you check the way the two political parties, NPP under Nana Akufo-Addo and NDC under John Mahama, managed these two crises, you see clearly that there is a world of difference between the competent Nana Akufo-Addo, compassionate Nana Akufo-Addo, and caring Nana Akufo-Addo's administration as against the incompetence, the lack of care that we saw.
Now, it will be proper for you to throw more light on the distinction between the two leadership, John Mahama's NDC, then Nana Dankwa Akufo-Addo's NPP, as far as their leadership prowess is concerned in terms of their crisis management.
Correct. I think that is a very intelligent question, and I think, like you read in the introductory commentary, in January 2020, the WHO, the World Health Organization, was notified of an outbreak of then an epidemic from the Wuhan city of the Hubei province of China. We in Ghana registered our first cases, I think, on the 12th of March. His Excellency the President, even before we registered our initial cases, had announced an initial investment into preparation towards a possible outbreak, because it had become clear that the nature of this virus, it is able to travel faster than many of the viruses in its group, its kind of group. And if you check, for instance, Ebola, that came some time back, the rate of transmission and the rate of transfer and so on spread is clearly different from coronavirus. So even before the virus entered into the shores, His Excellency the President, you recall the 100 million Ghana cedis that he had put aside for preparatory works towards COVID-19. This was before COVID even came into Ghana. And so we had started preparing way ahead of time. The President put together an interministerial committee, a task force, that he himself chaired, because he wanted to lead from the front. He was not going to, if you may, give or subjugate the health, the important matter, that serious pandemic that was ravaging the world. He was not going to leave it in the hands of his capable sector ministers of health and so on and so forth. He wanted to lead from the front himself. So he set up a coordinating center, a task force, that he himself chaired. Every evening, he sat in chair to coordinate the affairs of all the ministries. That interministerial committee was important because His Excellency's vision was an all-government approach. So every ministry, every sector, even non-governmental, everybody had to be brought on board. So that is why the need for that task force. He went ahead and appointed a presidential coordinator to manage the response. And who did he go for? His Excellency didn't go for the average political actor, either as a minister or somebody who we know. He went for somebody who we know as has played politics and has been with us. No. His Excellency looked at this critical matter, went for no less a person than somebody, a Ghanaian, who had served the WHO as Deputy Director General. And so this is somebody who had the knowledge in pandemic management, who had the experience with working with the WHO environment in matters around the time that COVID, for instance, Ebola, for instance, was around. This man was still in active service. And so it tells you clearly that the President's attitude was not to play politics with this important matter of COVID-19. That's why he went for the technical people. And he made a commitment that he was going to allow only the science and the data to guide decision making. And I think that actually marked the beginning of Ghana's successes as far as COVID-19 is concerned. To be able to do that, the committee led by His Excellency the President identified some major pillars around which we were going to combat COVID-19. The first pillar, was that we were going to limit importation of the virus into the jurisdiction. That is why you notice that even before advanced democracies like the United Kingdom and so on and so forth, even before they started, we had started with increased and enhanced screening at our points of entry. There was a popular video that was made the rounds. I don't know if you recall. The gentleman who works with one of the airlines came to Ghana, went back to the UK, saw the differences, and made an audio, and it went out very viral.
Absolutely.
Long before the United Kingdom started enhanced screening at the points of entry, we in Ghana had started that. Beyond that, we noticed that because the cases of coronavirus were being imported across other countries, we wanted to limit the importation. So what did His Excellency the President do? He caused for an advisory to be issued that if you came from a country with a certain number of reported cases, you were not allowed in the jurisdiction. Then that was also escalated. It got to a point that if you came into the country, you were going to be quarantined. You were not going to go home. You were going to be kept at the cost of the state. And you were going to be tested to ensure that you did not bring in the virus with you. And then our border was closed. So there were various stages that we had to go through under the first pillar to limit the importation of the virus into the country. The second pillar was to provide adequate care for the persons who unfortunately may get infected. And you know that in this country we have done free treatment. We did the isolation centers, the treatment centers, and I've heard testimonies from persons who have undergone treatment, and the food quality that they were even given. Many of the people have come out publicly to testify to even the quality of food, because the thing with COVID is that it attacks our your respiratory system, but your immune system has the capacity to ward it off and fight against it. And so healthy eating and rest are critical as far as management and treatment of COVID is concerned. You know that we don't have any cure at this moment or even a vaccine. And so if you take people into isolation, if you take people into treatment, and you don't give them the quality of food that can help boost their immune system, then you are not too sure, you are not fighting and you are not managing the virus well. So under that pillar, it is a matter of public knowledge that this government identified, and I can mention, and we are grateful to a lot of the non-government actors who came in because they saw the vision, they identified with the vision, they came on board to support. Like the Pentecost Church, for instance, that offered their convention center as an isolation center, and many others. The Ghana Football Association, for instance, who offered. All of these non-government actors came on board because they saw decisive action from the leadership, and that's why they came to support. The other pillar was to conduct aggressive testing and also to do contact tracing. Because, see, the virus, you can contract it, you can be infected, you can be asymptomatic, but you can spread the virus. So what Ghana decided to do, and that is why, one of the reasons why we have performed better than other countries, was to go after the virus. Because if you were going to wait, like other countries did, for people to begin to show symptoms and go to the hospital and receive treatment, by the time the symptoms begin to show, they may have infected several other persons. So what did we do? His Excellency says that go back. Before we closed the border, before we did mandatory quarantine, anybody who came into the country, let us find them, because at the point of entry we collect data. As a result of the enhanced screening that I spoke to you earlier about, we collected the data. So the president says that go back, let let us find everybody who entered into the jurisdiction. Let us test them. And if we find that you are positive, let us trace everybody with whom you have had contact. So for instance, if it is I who traveled and I came back and I identified and I'm tested and I test positive, they'll have to go to my office in the Ministry of Information because that's a potential place for me to interact with people and therefore share the virus. They will have to go to my church, for instance, and because I go to church, they will do all this investigation, and that was why we had to go through the lockdown even in the first place. Because the data had told us that majority of the people we were looking for were within the Greater Accra, the Tema, the Kaswa, and then the Greater Kumasi areas. Because when they arrived, one of the questions they filled on the questionnaire was that where's your destination? So we had a fair idea where the people were. That is why we had to lock down, so that the people can remain where they are, so we can go and look after them. So it was part of the pillar that we had, which was to aggressively do contact tracing and testing. And in this country, we have done testing for COVID-19 for free at the cost of the state. And it's expensive, an average of about $100 and something. The antigen tests that are being conducted alone are about $150. The molecular tests, the PCR tests that we are conducting were even much more expensive. But the states took the responsibility and absorbed all the cost of the testing. Another pillar upon which we were fighting this virus was to deepen our self-reliance and to increase our production capacity. One thing became clear, Echo. When COVID struck, we needed, for instance, hand sanitizers. The whole world, everybody wanted hand sanitizers. Elasticity of demand and supply dynamics and all of those economics were now at play. Supply, there was shortage in supply because the demand had risen astronomically. And so even if you had money, the goods were just not there for you to purchase. But remember that before even COVID-19 came, His Excellency the President, with the vision of Ghana Beyond Aid, was to already increase our production capacity. That was why he even brought the one district, one factory. So if we had a Nana Akufo-Addo 10, 15 years ago, many of the things that we were now importing and begging virtually, including nose masks, including all the PPEs, we had the money, but we couldn't find them to buy. It is a manifestation of the lack of leadership within the last few years. And if there was a Nana Akufo-Addo, and if there was the industrialization drive and the Ghana Beyond Aid movement like we are seeing now, a few years back, we would have been in a position to deal with this matter by ourselves. So one of the learnings, and His Excellency said that no, we must take advantage of the moment and prepare ourselves so that next time something like this happens, we should be in the position by ourselves to deal with some of these things. So what did he do? He quickly mobilized for local production of the things that we need. Many of the PPEs like the one I'm wearing today, today we are producing in Ghana. But at the start of COVID-19, we had to import everything, including hand sanitizers. So hand sanitizers that were selling at around 10 cedis per bottle, because of a shortage in supply and increase in demand, the prices shot up. Some as high as 70 Ghana cedis and so on and so forth. But you notice that within about 2-3 weeks, when the president called industry players, especially in the pharmaceutical industry, and mobilized and raised resources for them, and tasked them to go out there and provide the needs of the people of Ghana, Ghanaian companies started producing some of the PPEs. In fact, now almost all the PPEs that we are using are being produced. This leadership, he had responded in a timeous manner, and Ghanaian companies started providing PPEs. We also had another pillar.
No, but before you go on to the other pillar, today you want to get interactive. If you want to send us a WhatsApp message so that you will be able to contribute to the program, just go to WhatsApp and just go to the number 0540109009. 0540109009. Do not call, just send a WhatsApp text. Honorable, can you go to the next pillar?
So, yes. So, the next pillar, before I even get there, I'll just mention a few of the figures. So that, for instance, face masks. Ever since we started implementing that pillar, about 18.8 million pieces of nose masks had been sewn here locally. Ghanaian companies. We had some big companies, about 12. They are big companies, they are tier 1, but 12 of them. Then there were about some 35 tier 2, and then there were 38 tier 3. The 38 tier 3, they are small companies that we mobilized, and they were into the production of these nose masks, for instance. We also identified 3 fabric companies, textile companies, because these PPEs, including face masks, hospital gowns, head covers, medical scraps, they are all produced with material. And our textile industry has been struggling and complaining. And so you have to seize the moment and empower them and support them to ramp up production. And that is why over 3,760,000 yards of material locally produced have so far been used to produce, for instance, about 18.8 million face masks. Hospital gowns, 90,000 hospital gowns. Head covers, another 90,000 head covers. Medical scraps, 60,000, all produced here in Ghana. These are material and equipment that until recently we had been importing. You know how much money we would have spent in dollar terms if we were importing these equipments? $16.8 million. We would have taken Ghana's money and pumped it into another country's economy. 16.8 million. Just on the matters that I just, on the equipments that I just identified to you. Can you imagine the number of jobs that were created? The tailors and the seamstresses and the designers and all in the value chain who got employment. Can you imagine the numbers? In excesses of 10,000 were employed because we had a visionary president who sought under his pillar to increase our production capacity and to deepen our self-reliance. He says that no, let's do these things locally. Then we also had another pillar, which was to mitigate the impact of the virus on our socio-economic lives. Because we had admitted that COVID had come, we had to social distance. In fact, we had to lock down at a point. Like I explained, that we needed to go after people and test them so that we are ahead of the virus and not the virus being ahead of us. So there definitely would be socio-economic implications on human life. Because we have a compassionate and caring president, Nana Akufo-Addo decides that even water he was going to give us for free. Electricity he gave us for free. For those of us below the lifeline, free. Those of us above the lifeline, 50%. Insurance package for workers, health workers. PPEs were provided to all category of persons, including students and people in the health workers, and so on and so forth. Then the president also sought to reach out to businesses who may have been affected by coronavirus. The coronavirus alleviation support program for businesses that is run by the NBSSI. Initial 600 million, today 1 billion. And so you see clearly that the president has been very, very deliberate. He has been organized and he has coordinated Ghana's response in such a manner that today, I'll give you some statistics. By the 17th of October.
Before we go to the statistics, let me read some few messages from our viewers. His Excellency President Akufo-Addo has distinguished himself well since he became president, and his handling of COVID caps it all. We will give him 4 more to do more for us. There's KD from Adenta. Another one from Samuel Brian Wabin Awoshi. He said, Mr. Muhammad and his enablers sat down in their armchair when cholera was slaughtering en masse. They couldn't even share a sachet of ORS or a blister of zinc tablet during their moribund maladministration. About 240 Ghanaians died of that cholera outbreak in Accra. President Akufo-Addo, his able team, and by your various commitments, has performed better, by which the citizenry is proud. It is for a reason that they all save, but for Akufo-Addo's stellar leadership, the unthinkable would have happened to us. Ghana is in safe hands and competent hands. God knows what is good for his people, hence Akufo-Addo we have today. By his leadership, we will prevail. This is from Samuel Brian Bobin. Another one also from, okay, he said, good evening, fantastic host. I am Ejoso Sir John. I would like to take the opportunity to thank President Nana Addo Dankwa Akufo-Addo for his dedication towards the fighting of the COVID-19 pandemic. He has really done well and needs commendation. He is the best president for Ghanaians at this point in time and must be voted for to continue the good work. One good term deserves another. 4 more for Nana to do more for us. And that is from Ejoso Sir John. This one too is from, said, please, I want to know if it is true that NAPCO trainees will be made permanent. Okay. His Excellency has no size. GM can't be compared to him. Nana 4 more to do more. This is Buzua Gushegu. We will take 1 or 2 before Deputy Minister gives his statistics. Good evening, my mentor call. Indeed, the MPP is the best. Indeed, the MPP is the best managers of the economy. They have really done a good job. 4 more for Nana to do more achievement. Santa Maria. Okay. This one also, in fact, MPP has done a lot to the good people of Ghana. I am a NAPCO trainee and I can testify. Just looking for mechanizing us from Alasan Seidu Neribihe Zongo. Okay, I'll read 1 or 2 more. Then, even the dead and dumb can see the fantastic job done by this competent administration of Nana Addo Dankwa Akufo-Addo and the noble Dr. Mahmoud Baumia. So no need to stretch yourself so much. My name is Zenjina from Tamale. MPP is the best in terms of tackling problems. Well done, Nana. I think the NPP, okay. So, Grace, this is from Grace from Nkatia. Nana, you do all for more good vision for the youth. We'll come back to Honorable Deputy Minister. Honorable, you're giving us some statistics in terms of the COVID-19. Yes,
Echo, and we are grateful to the people of Ghana for sharing those testimonies with us.
Right.
We had conducted approximately over 510,000 tests.
Right.
Putting us in the category of countries that has tested per capita the most. We are in that category. And that is why an internationally reputable news outlet in Asia, in a research it recently conducted, places Ghana amongst the top 10, in fact, the number 3 in the whole world, only after China and Sri Lanka, as the most responsive government in the fight against COVID-19 and mitigating its impact on the people.
So put differently, Ghana is doing better than US, Ghana is doing better than the United Kingdom, Ghana is doing better than
Germany,
Canada,
than France.
Germany and all that.
Only China and Sri Lanka are doing better than us.
Right.
In Africa, we are number 1. And why? If we have done these numbers of tests, out of which about 47,000 total cases and over 46,000 recoveries. In fact, total cases out of 17th October, 47,461 total cases confirmed. The ones that have recovered out of this, 46,752.
Right.
Unfortunately, we have lost some 312 of our colleagues. But you see, this is what it means. Ghana's recovery rate is at 98.5%. Compare that to the world's average, the average world rate, 74.7%. That is the world. Africa, 82.1. That's the African average recovery rate. Ghana, we are at 98.5. Okay?
Yes.
The death rate, yes, and our condolences to the families of our fallen brothers and sisters. But it could have been worse because, look, our death rate, 0.66%. The world average, 2.8%. African average, 2.4%. We are doing 0.66%. Definitely, yes, we are grateful to God for continued mercies. But the other African countries and the rest of the world that are seeing these relatively lower recovery rates and relatively higher death rates, it's not because God doesn't love them. God loves them just like he loves us. But the addition that we have, which they may not have, is responsive and responsible leadership. And that is why one of the texters made the point about cholera outbreak in Ghana and the attitude of the then administration as compared to what we are seeing today. And we have always said that their tantrums and their so-called alternatives have only been politically motivated. It is not led by the science. It was not led by the data. You recall that when coronavirus broke out, our colleagues in the NDC, the first thing they did was that, oh, go and bring back our colleagues from China, bring them back. Countries like Italy did that. How did it end for them? South Africa did that. America did that. Today, over 200,000 people have died in America for COVID-19. The path that America took was what our colleagues, especially in the NDC, were asking us to take. That same path Italy took, that same path South Africa took. That was what they were asking us to take. It was not science. It was not data. It was just politics. Okay? So there is every reason for the people of Ghana to suggest to us that, there is no sense in changing a general in the middle of a war, particularly when that general is winning the war. It will be too risky a gamble to take, especially on knowing the background and the track record of the person who is suggesting that we should change Nanado for him. This is somebody who could not handle cholera. Cholera that we all know the treatment, fundamental, ORS, zinc, and so on. Just the provision of places of convenience. And that's why when you hear some of our colleagues in the NDC claim that the NPP is been talking of providing modern places of convenience, and they laugh at it, I laugh at them because they clearly have no understanding of the challenges that the people of Ghana have been confronted with. No wonder they were so incompetent in managing the affairs of state. Governance is not all about one or two large infrastructure. Large infrastructure is okay, but we are constructing even larger infrastructure. The first 4th-year interchange in West Africa is being done by Nana Akufo-Addo. He is constructing 6 interchanges at the same time, unprecedented in our country's history. So it is not as though we don't know about large infrastructure. The biggest water project in the whole of the northern sector, Nana Akufo-Addo, the Tamale Water Project. The biggest irrigation dam would be by the time we finish with Pualugu. And recall that before Kufo left, we had already acquired loan, and just a small diversion. Kufo had acquired $500 million loan for the construction of Pualugu before he left. Our colleagues in the NDC came and diverted that $500 million. Only God knows what they used it for. Until Nana Akufo-Addo came, anytime there was a spillage of the Bagri Dam, we lost Ghanaian lives, precious Ghanaian lives, because the NDC diverted that money, $500 million. They should be asking, we should be asking Mr. Mahama and the NDC some real questions, and they should be providing some answers. We are talking about lives of our brothers up north. And he will always claim that I'm a Northerner. The money is meant for the construction of the Pualugu Dam to save the lives of our northern brothers and sisters. You diverted, and you did not resolve the challenge. It is only Nana Akufo-Addo who is constructing that biggest irrigation facility, which will also double as a hydro power generation facility as well. So we know about big projects. But in addition to the big projects, we also know that there are some fundamental needs of the people, such as places of convenience, that must be resolved. And that's why we are resolving that. No wonder we are no longer hearing about cholera and so on and so forth. But even when they were there, and cholera stroke, how did they deal with it? Now, to suggest to the people of Ghana that, yes, we have a general who is winning the war against COVID-19, the whole world recognizes that. Our numbers are very, very low. They are very encouraging. When our students were going to write their final exams, oh, without the data, without the science, oh, don't do it. Students will go and die. You want to kill our kids. Just pressing the emotive buttons of people without any science, without any data. We managed the process, we provided the PPEs. The students have gone because we do not want this to be an excuse to curtail the education, which is the future of the youth of this country. So we managed the situation. All our final year students, from university to secondary to JHS, all of them went through the process and they can go on with their lives. Now they are suggesting to us that we should change the general in the middle of a battle that we are winning. That is not right. And that's why I thought that I should share some of this data.
Right, but we have 1 minute to go. We have
and again, let me also say to you that we have only 5 regions. We have, as we speak, there are 5 regions in this country with no cases. 5.
Right.
We have 6 regions today. Their cases are below 10. 4 regions, their cases are below, they are between 11 and 20. Yes. It is only in Greater Accra that we still have cases above 100. So generally, Nana Akufo-Addo has done well. That is why, even in our manifesto, we have dedicated a whole portion of the manifesto towards COVID-19, because you see, 2021 is going to be the post-COVID era, hopefully. Because science has advanced now, some clinical trials are happening, and hopefully very soon we may get a vaccine. Whether we get a vaccine or not, 2021 is the post-COVID era. What do you do post-COVID? And that is why we are talking about the Ghana Cares, the 100 billion 4-year project that will have to involve massive investments into infrastructure, support to businesses and individuals. That has been happening, like it's been happening already. We want to expand this because we need to help to carry the people out of the doldrums, and we need to, like Mr. President said, now revive the economy. In conclusion, Echo, let me just suggest that, you see, my departing words, an attempt to want to vote for Mahama would be an attempt to buy a cloth. Give the cloth to a carpenter to make a dress for you.
Right.
That cannot happen. It will be a disaster. If you bought a cloth, you better give it to a seamstress, a dressmaker, a designer to make you your dress. You don't buy your cloth and go and give to a carpenter to make you a dress.
Thank you so much, the Honorable Deputy Minister of Information, Honorable Pius Hazide. Indeed, we know how to bring the economy back to life. What we do not know is how to bring dead bodies alive. Now, the point we want to make today is that there has been 2 leadership from 2012 to 2020, the John Dramani Mahamad's administration and Nana Dankwa Akufo-Addo's administration. These 2 people have shown as to how, when there are crises, they will be able to lead. Clearly, His Excellency Nana Dankwa Akufo-Addo has distinguished himself as a stellar leader, or as a person who could lead the country in times of crisis. On this note, I hope that Ghanaians are going to give him 4 more to do more for the Ghanaian people.
Don't forget that coming Saturday is MPP Colors Day.
Oh yes. Wherever you find yourself,
red, white, and blue.
Put on the party's colors. That is the red, white, and blue. And again, we are number 1 on the ballot paper.
Yes, number 1.
And I hope that after the voting on the 7th of December, we are still going to be number 1.
I heard one senior journalist say today that
on peace,
the results of the 2020 presidential ballots have come already.
And he said that in Chi. I'll see you next week.